Hello everyone, this is Erin Asbell, and today Linda Pham and I are going to discuss the Hayling Sentence Completion Test by Burgess and Schalise and the Executive Function and Route Finding Test by Boyd and Sauter. I will begin with a discussion on the Hayling Sentence Completion Test. The Hayling Sentence Completion Test was created to evaluate neuro patients with damage to the frontal lobe. The goal of this assessment is to determine how the frontal lobe damage is affecting the patient's executive function. This assessment can be administered to patients ages 18 to 80. It is individually administered in approximately 5 to 10 minutes and is an entirely verbal assessment. This test assesses two areas of executive function: response time and suppression of automatic response. There are 30 sentence completion items total, divided into two sections of 15 questions. The first section targets response time, and the second section targets suppression of automatic response. For Section 1, the clinician will instruct the patient to complete the sentence read aloud using a connected and meaningful word. For example, when you go to bed, turn off the. A correct response to this would be the word light. The patient is scored on their ability to respond correctly and timely. Responses are timed and rounded to the nearest whole second for scoring purposes. For Section 2, the clinician will instruct the patient to complete the sentence read aloud using an entirely unrelated word. For example, she called her husband at his. A correct response to this item would be any word that is unrelated to calling a husband. For example, elephant. The patient must suppress the automatic response associated with this phrase, which would be to say work or office. Answers are scored according to three criteria: unconnected speech, such as the word elephant; connected, such as the word work or office; or somewhat connected, such as the word telephone booth. For this section, connected or somewhat connected words would both be considered incorrect responses. Responses are timed and rounded to the nearest whole second for scoring purposes. Burgess and Schalise in 1997 created the Hayling Sentence Completion Test from sentence completion norms from Bloom and Fischler 1980. These sentence completion items were found to have a high rate of accuracy for producing the correct response. Section 2 of this assessment, which measures suppression of automatic responses, shares much of the same concept as the Stroop test from 1935. The Stroop test measures suppression of auditory responses by giving participants color words printed in different colored ink. The word blue printed in red, for example. Participants have to suppress the automatic response to read the word and instead identify the ink color. Reliability measures for this assessment were calculated and revealed an overall reliability of 0.76. The test-retest reliability was adequate for response time and overall measurements, but not for error scoring. There was no inter-rater reliability provided in the test manual. In regards to validity, this assessment cited more than 50 studies in the test manual as evidence of construct validity. In addition, concurrent validity for this assessment is supported by the comparison studies between the Hayling Sentence Completion Test from 1997 and the Stroop test from 1935, which both measure similar factors of executive function. Lastly, this test only focuses on the most pertinent factors in difficulties experienced by people with frontal lobe damage during everyday functioning. Therefore, it can be efficiently administered and utilized by clinicians, giving this assessment tool strong ecological validity. Implications to consider for this test are as follows. This assessment had an inadequate sample size for the complexity involved in brain function, a sample size of only 121. A larger sample would create more diverse norms. In addition, this assessment had poor test manual directions on response classification, resulting in poor reliability measures for error administration and scoring. More precise instructions for scoring errors would likely result in better reliability measures. Lastly, an inter-rater reliability rating would strengthen this assessment tool.
Executive Function Route Finding Test by Boyd and Sauter, 1993. According to Sahlberg and Mater, nonspecific or open-ended tasks or activities can be especially useful in assessing executive function. Thus, route finding was selected for study in this investigation, not only for its relevance for real-world problem solving, but because of its open-ended nature. One's destination can be achieved by a number of different routes, on the basis of a variety of levels of plan, and with ample opportunities to detect and correct errors. In the next 5 slides, you will see a rating scale. The rating scale addresses the content areas of task understanding, information seeking, retaining directions, error detection, error correction, and on-task behavior. The first of the 5 slides includes the instruction and the task understanding. Instruction: I am going to give you an exercise which involves your finding of an unfamiliar office. How you do this is up to you. I will go with you but cannot answer questions about how to find the office. I want you to do this exercise as quickly and as efficiently as possible. Before you begin, I would like you to tell me what I have asked you to do. Within this slide, you'll notice task understanding. This involves not only verbal comprehension of instructions and the ability to paraphrase them, but also the ability to grasp the nature of an open-ended task based on fairly sparse guidelines. Section 2 and 3 include information seeking and retaining directions. Information seeking is concerned with the plans or strategies by which the client sought information on how to find the destination. Performance varied greatly in both the nature of information sought, such as signed, staff directions, and whether specific directions were sought before or after starting the search. Retaining directions deals with your functional memory. Clients may take notes in order to help them remember specific information. Section 4 and 5 include error detection and error correction. Error detection involved the extent to which the client spontaneously noted discrepancies between directions and performance, or surroundings. Error correction involved the level of independence shown in troubleshooting once difficulties were encountered. Error-free performance produced high ratings in the areas error detection and correction by default. Area 6 includes on-task behavior. This involves the extent to which digressions from the task in speech or action interfered with efficient performance. Within this slide, you will notice that the EFRT evaluates potential contributing problems, such as emotional, interpersonal, communication, perceptual, as well as motor. Within this slide, you'll notice a rating scale. The scores range from 1 to 4. 1 denoting extensive dependence on the examiner, 2 denoting appreciable dependence on concrete information or guidance from the examiner, 3 some dependence on cues to self-monitor, to devise a strategy, or otherwise to utilize one's executive functions, and 4 indicating independent completion of the task. Who rated these patients in this study? Neuropsychologists, secretary, research assistants who had training that involved hypothetical cases and mutually rating the performance of pilot subjects. An average score was obtained by dividing each rater's total across content areas by the number of content areas rated, 6. Procedure for the EFRT. 2 staff members should accompany the patient. Start at a designated point and to locate an office on campus not familiar to the patient. Few constraints were provided, except that the client not ask the observer for assistance, and that he or she finish the task as quickly as possible. Note, the patient can ask for directions from others, although the client was not given this information. In the first video, you'll notice the directions.
Alright, I'm going to give you an exercise which involves you finding an unfamiliar place. That's going to be the lunchroom. How you do this is up to you. I will go with you, but cannot answer questions about how to find the office. I want you to do this exercise as quickly and as efficiently as possible. Before you begin, I would like you to tell me what I've asked you to do.
To find the lunchroom.
Okay? And you're going to find it as
Fast as possible?
as efficiently and quickly as possible.
Okay.
Okay. Alright, so what are you supposed to do?
Find the lunchroom fast.
In patient 1, she was able to describe what she was asked to do. She was able to repeat the information when asked by the clinician. but when it was time to start the task, she was unsure of where to go. If we were to look at our table, Section 2, Information Seeking, you'll notice that she would score a 1. She is aimlessly walking around, or wandering. Does she show judgment for information sources? She walks past a map. Does she look for staff members to help her in order to clarify? She does not. She continues to walk. Notice how patient 2 has a plan. She looks at the map, she passes a stranger, and asks him a question. She continues on to her direction, looking around at her surroundings.
Lunchroom, you're going to go all the way down to the end of the hallway, and you're right, and you'll see it right in front of you.
Okay, can I go right at the end of the hallway?
Yes.
Validity of the test. The route finding task is sensitive to higher integrative functions of the brain. The subjects within the study were more dependent on nonspecific or executive cues than on specific concrete ones. They needed not to be told what to do, rather they needed cues to think for themselves about what needed to be done. Implication. Closed-ended questions of the common facts or puzzles made more difficult for patients with frontal lobe injuries. The EFRT deserve further attention because of the different look at executive functions. The subject provides his or her own plan and structure and modifies it according to feedback from the environment and achieves the desired outcome by any of the number of strategies and routes. The task emphasizes on flexibility compared to more standardized measures.